Good morning, Kalispell. I hope you are all doing fantastic today. So on today's Wellness Wednesday, we're going to talk about non-invasive stem cell therapy. So we're going to talk about the magnetolith from stores, and also we're going to talk about the hyperbaric chamber because they both are able to achieve non-invasive stem cell results. And the best part is no pokey, no surgery, and it's pretty wicked awesome. That little white and gray cube over there with kind of the looking tennis racket looking thing is the magnetolith. We've been using that for well over a year at this point, and directly from Stores Medical. So it does fall under the category of PEMF, or pulsed electromagnetic therapy, which is FDA approved. It is a safe and effective therapy for helping heal fractures, muscle stimulation, urinary problems, cervical fusion, depression and anxiety. Talk about the pain loop there in a different video. Brain cancer, osteogenesis stimulation, bone fractures, and non-unions. So basically in this study, which I will post in the video below, and then I'll post another link from the International Hyperbaric Association, when they treated people with this device, they were able to track mesenchymal stem cell activation. And basically your mesenchyme is everything but your nervous system. Pretty cool, very effective treatment. Not really painful. The treatments take about 10 minutes. Pretty wicked awesome. You do hear a little click from it. If I had it on, I would kick it on real quick and let you guys hear what it sounds like. Truly awesome piece of equipment, and to date we've treated several thousand people with it. Absolutely killing it with that machine. It does awesome on sprains as well, like sprained ankles. We saw one where we did 3 treatments with it and just blew this thing out of the water in a good way and got the person back to doing what they wanted to be doing quicker. That's what it's all about. Now, let's get started on the hyperbaric chamber, or hyperbaric therapy. So, stem cells have the ability to differentiate into many different cell types, and basically they serve as our body's internal repair system. Pretty awesome. They can turn into bone, skin, muscle, ligament, tendon, brain, spinal cord, things like that. Hyperbaric oxygen therapy has been shown to significantly increase the concentration of circulating stem cells or progenitor cells within the peripheral circulation system. Pretty wicked awesome. By increasing our blood plasma oxygen levels, bone marrow-derived stem cells, mesenchymal, were shown to significantly proliferate and mobilize, so we can get them out and get them moving around. Pretty awesome. So the documented physiological side effects, or the physiological effects or side effects, it helps activate the nitric oxide synthase, NOS3, proliferates and mobilizes bone marrow-derived stem cells, improves engraftment and differentiation of several progenitor stem cell types and organs such as the spleen, bone marrow, brain, peripheral nerves, pancreas, cartilage, and heart. It increases colony-forming cells. It increases stromal-derived growth factor, which is huge. Increases the endothelial growth factor for angiogenesis, which is new blood vessel formation. And it increases pluripotent stem cells. Those are just stem cells that can become many different tissue types. So some of the clinically documented effects: it helps accelerate growth and repair of damaged tissue. A bunch of studies on that with gangrene. It improves regeneration and organ functionality. Hello. Promotes neurogenesis, which is nerve growth. Helps stimulate osteogenesis, which is bone growth. Helps alleviate diabetic symptoms and enhances the recovery from heart attacks. So in a study done back in 2005, they looked at 26 patients who had basically a bone weakening disease following radiation therapy for head and neck tumors. So it's a post-cancer thing. All of the patients underwent 20 treatments within the hyperbaric chamber, and they did blood sample collections after the first, 10th, and 20th treatments. The CD34 cells, which are found in conjunction with pluripotent stem cells, doubled after the first treatment. What? And increased by 8-fold by the end of the 20th treatment. Pretty awesome. Colony cells also significantly increased. Vascular endothelial growth factor and stromal derived growth factor also increased as well. So the study concluded that hyperbaric oxygen therapy mobilizes bone marrow derived stem cells and progenitor cells by nitric oxide synthesis. Pretty wicked awesome. So if you guys have a chronic health condition, please get a hold of the office. We're not exactly letting anybody play with the hyperbaric yet. We just want to get some more things dialed in the room that we have it in. And trust me, you guys will be the first to know once we are actually up and running and accepting patients. If you have any questions, please post them in the comments below the video, where those research articles will also be linked, and we will get back to you as soon as possible. Have an amazing day. See ya.